Hello and good morning. Greetings from Pakistan. My name is Kiran Bashir Ahmed and I am a senior lecturer at the Institute of Professional Psychology, Bahria University, Pakistan. My work is on the gender discrimination that is prevalent in disabled adolescents, male versus female. I have looked at a number of sensory and physical disabilities prevalent in Pakistan. This includes work done on blind, deaf, as well as physically disabled adolescents. In Pakistan, sadly, little work has been done related to disabled adolescents, specifically in the area of psychology. And through this research, I hope to fill that gap. Before we delve into the literature review surrounding psychological adjustment and disability, we need to understand the definitions of both. Psychological adjustment has been defined in this study by Haber and Runyan's definition given in 1984. This is the ability to have an accurate perception of reality, the ability to cope with stress and anxiety, having a positive self-image, the ability to express the full range of emotions, and to have good interpersonal skills. Disability, on the other hand, has been described as the difficulty or loss of ability of an individual to meet socially defined behavioral expectations. This has been broadly categorized in two dimensions for the purpose of this study, that is, sensory or physical disability. However, there are those like Schillmeier in 2008 who describe inclusive differences in disability as the practice constituting disabling practices in everyday life. And this, he says, is brought about by the relationship between the sensory experience and the material environment. He argues that this is a perspective that is highly neglected by social science as well as disability studies. Previous literature reviews have also supported this trend, and there have been several researches conducted in Pakistan that show gender inequality. The important variable here is that of adjustment, and in my research, adjustment, psychological adjustment, is what I have focused on. Here you can see a distinct division between the researchers involved in discussing the adjustment of males versus adjustment of females. For example, in the first one, Mehta in 1984 discovered that in the Pakistani and Indian cultures, boys are seen as the natural breadwinners of the family, and consequently, it has been observed that much more care is taken of their needs, as in the case of the blind, than those of girls. We cannot ignore those researchers that show a mixed picture. For example, the research by Khan in 2008 shows that no significant gender differences are discovered in adolescents with low vision, especially in the 12 to 17 years age group. On the other hand, when we examine those researchers that are focused on females, we see that the picture is completely different. Among the handicapped population in Pakistan, Ayubia in 1986 discovered that the better social adjustment happens in boys as compared to girls. According to her, girls experience inferiority complex, especially when they are disabled, and along with that, they also experience a sense of uselessness and lack of confidence, which is significantly different from that of boys and affects their self-esteem. Ahmed, doing his research in 2003, has found similar observances. Along with that, researchers Bano and Hamid in 2011 have severely criticized the quality of teachers as well as the equipment for physical education provided in special schools. Their work shows a marked disparity between these girls as compared to the boys and the normal population. According to them, as a result, the physical posture of the girls is affected, and even the curriculum along with the sports opportunities provided lag behind severely in terms of international standards. According to Banu and Hamid, Pakistan has a generally conservative cultural context, and activities that may bring the girls in contact with males outside the classroom are discouraged. And, on the other hand, they make them focus more on studies to supposedly fill in that gap. Expectations play a rather important role. It's important to note here that many disabled girls in our society are hardly ever expected to get married. And even if they do get married, there is additional pressure on them because society already expects that they will do much less than others. The process of the study took place in 5 distinct stages. Initially, test selection took place, and the psychological adjustment scale made by Sabir in 1999 was taken to measure the levels of psychological adjustment. This is a scale that can be used with youngsters, adolescents, or even old people. It has been standardized with university students, and for this population the scale has high reliability. It is a 5-point rating scale with response categories from strongly agree till strongly disagree. It has a cutoff point of 81. A distinct factor that distinguishes this scale from the others available are that this scale is in Urdu, which makes it easier to approach the local population. After this, the demographic information questionnaire was developed after consultation with doctors, teachers, and those who specialize in the care of special students. This demographic information questionnaire included information about the name of the participant, the marital status, birth order, education, number of siblings, family structure, occupation, socioeconomic status, and the nature of sensory or physical disability, including its type, the duration, and the cause. At the 3rd level, the sample was then identified, and a total of 100 male and 100 female disabled adolescents between the ages of 12 years to 20 years with blindness, hearing impairment, and physical disabilities, that is, orthopedic disabilities, were included in this sample. Various vocational training centers, special schools for the blind and the hearing impaired, and occupational settings in Karachi were explored to conduct detailed interviews and build adequate rapport in order to use psychological tests with them. Certain types of physical disabilities were excluded from this study. These were the difficulties that involved cognitive and intellectual deficits in thinking, judgment, and perception as well, or those who were diagnosed with autism, mental retardation, attention deficit hyperactivity disorder (ADHD), or cerebral palsy. I must point out here that while I was collecting data, it was disconcerting to find a large number of females who had stepped out of their house for either the first time, as in the case of 2 blind girls I discovered, but apart from that, even other hospital settings had female clients coming in only out of their houses to visit the doctor. And apart from that, they had no social activities, no form of social communication, and hardly any friends. This does not warrant for a very high level of adjustment in the first place, because psychological adjustment does contain factors related to self-esteem, coming from interaction with others, as well as social support. And if these are not there, then the females will find it very hard to adjust. The Table 1 shows the gender distribution of the disabled adolescent sample data, a total of 100, in which there are 40 blind, 34 deaf, and 26 physically disabled adolescents. Here you can see that there is very little difference in the number of male and female adolescents included in the sample study. The results altogether show that males rank much better on the variable of psychological adjustment as compared to their female counterparts. The second table here shows the results of the t-test between disabled male adolescents and disabled female adolescents. Here we can see that the hypothesis is accepted as a highly significant difference at the 95% confidence interval is observed in the mean psychological adjustment scores for disabled male and female adolescents. where the p-value is less than 0.05. The significance of the two-tailed hypothesis can here be seen as 0.012, which is a highly significant difference. The results overall show a bleak picture when it comes to the effect of psychological adjustment in Pakistan for disabled adolescents. The males rank much better than females, and this is sad with the respect that there are many female adolescents out there who actually need help, and psychologists have done very little for that. We can see that the results show significant support for the hypothesis. The results for this study with regard to gender differences can be understood under the umbrella of the predominantly patriarchal society of Pakistan. Here, many women are confined to their homes, and movement outside the home or indulgence in activities that may grant them social freedom is frowned upon or considered undesirable. Perhaps this is why Zaidi, Mohsin and Saeed discovered even strong support for adult physically disabled females to be diagnosed with anxiety and depression as compared to adult physically disabled males. Hofstede in 2001 came up with a 5-dimensional model. This model has been used cross-culturally, and on the dimension of masculinity-femininity, Pakistan ranks 50, which means that Pakistan is a masculine society. Such a society is largely driven by models of success, achievement, and hard work. Males are supposed to be the breadwinners, whereas females stay in the house, are hardly expected to have any say in their own rights, and the picture is much worse whenever it comes to disabled females. Disabled females are hardly ever expected to get married, and even if they do, the pressure is much worse. During the interview process, it was discovered that there was a gender discrimination in studies as well. Disabled boys were sent to vocational training centers while disabled girls were kept at home. And this was quite often due to the overall patriarchal structure of society as well as the socioeconomic status. This created pressure in many ways on the disabled male adolescents. However, it also provided them with a supportive environment both inside and outside their homes where they were allowed to showcase their abilities, bring back earnings, and consequently increase their feelings of self-worth. This resulted in better adjustment patterns. Most females, on the other hand, were found to be leading a severely restricted life, bound by cultural norms and traditions, especially in the more conservative households. The results of a report by UNICEF in 2003 mirror this pattern. It is seen there that the girl receives poorer quality nutrition, healthcare, and attention, which may later affect the life expectancy. It's interesting to note here that a few girls actually seemed quite content with their lot, and they had adjusted to the protection this lifestyle seemed to provide them. Still, there were those who openly regretted the loss or lack of their movement. For many parents, security issues are a major concern, and they were more confident about disabled males being outside the house than disabled females. The issue of restriction and disability thus emerges, providing a safety net within the confines of the home on one end and an increase in frustration levels, lowering self-esteem and feelings of competence on the other end. Therefore, it is interesting to note that in a cosmopolitan city like Karachi, very little has been done for disabled adolescents with respect to their psychological adjustment. Much has been done and is still being done for their physical adjustment, but little attention has been paid to the psychological aspects. Perhaps it is a need for us to wake up and do something about it. To conclude, we can say that global trends, research evidence in Pakistan, and the implications of this study point towards a greater need for understanding the needs of female disabled adolescents. Adolescence is the best time period to introduce interventions on a clinical as well as educational level, and here we can target the adjustment and coping strategies of disabled female adolescents. There are a few limitations of this study. The sample size poses 1. The study has also utilized traditional methods of psychological testing due to the unavailability of psychological tests for any of the variables, made in Braille or in sign language, and this also is a recommendation of the study that future tests could be made in this direction as well. Another recommendation is to have a cross-sectional research design across different strata of age-related subgroups. Thank you very much. I hope that the results and the discussion provided here have added to some of the field of knowledge and will prove for a fruitful discussion in your future reviews. Thank you again.